So this is a two-day event for 40 students where they get to have a real feel for what it's like to study medicine at university and become a doctor. So those 40 students are with us for 2 days. They've been doing some clinical skills, which includes things like suturing, venesection, as well as some anatomy teaching in our labs, where they've got to speak to current doctors and try and work out what's wrong with different patients. As well as that, we've had a keynote speaker talking about the future of surgery and using robotics in surgery. And we've also had a tour of our research facilities and a talk by some of our scientists about all the sort of research that we do here at the hospital. They've also had a tour of the acute medical unit. They've been doing basic life skills. They're going to be speaking with more of our researchers and more of our clinical doctors, because it's really important we give our young people the chance to ask lots of questions about what it really means to be a doctor and to study at university. So we couldn't do any of the work that we do without student ambassadors, and they support throughout the 2 days, whether it be leading some of those clinical skills, or they also work as mentors in their smaller groups, helping answer any questions. So on day 2 of our summer schools, we repeat a lot of the activities where we swap the groups around. But we're also going to be doing a workshop to do with biomedical engineering. So they're going to be doing VR, they're going to be looking at prosthetics, and we're going to be talking about communication as well and how important that is if you want to become a doctor. And one of the last activities, we have a talk with Professor Sally Curtis, where she's talking about admissions to university. So although the students that we're working with are still quite young, they're aged between 13 to 16, it's really important that they know early on so they can make informed decisions about what it is they want to do in the future, and if even medicine is for them. So we have a talk and their parents are invited, and we tell them all about the admissions route to medicine, and that is what our student ambassadors can also use their real life experiences of being a medical student and how they got there. So we've been running this event for a number of years. During COVID we had to have it virtual, but we're so thrilled to be able to have it back here at the hospital, where the students get hands-on experience of those clinical skills and seeing those different specimens, as well as having interaction, face-to-face conversations with our clinicians. So it's a really good event.